Good evening, or no, not evening. Good afternoon, everyone, and welcome to today's conversation of PAW Chat. This conversation today is one that you're not going to want to miss because there are so many questions about should you take the vaccine? Who should you trust? What information should you trust? What age group should get it? Was it rushed? How long it has taken? All of those questions are going to be answered today. We have an amazing resource who is going to be on today with our presider, Bishop Theodore L. Brooks Sr., who is going to share some information with you. And also, you'll be able to put your questions in the comments section pertaining to the COVID-19 vaccine, and we're going to answer them live on the air today. I'm Evangelist Nietzsche, Marketing and Publications Director for the Pentecostal Assemblies of the World, and I just want to thank you on behalf of our presider, Bishop Theodore L. Brooks, and the Pentecostal Assemblies of the World for allowing us to come into your workplaces, your homes, into your environments whenever we are on live. So be sure to hit the share button and the follow button if you're not already following this amazing organization so that you can stay connected with everything that we're doing here. You can also drop your comments in the comments section. Let us know which council that you are watching from, as well as any questions that you have about the COVID-19 vaccine. Okay, let me give you an update on what has been happening at the Pentecostal Assemblies of the World. This is our new bookstore. Yes, we have a new bookstore. So now all of the things that you want to be able to purchase are at www.pawbookstore.com. You'll see that here, www.pawbookstore.com. Everything that you need is here. Look at our amazing presiders, Bishop Theodore L. Brooks Sr., Bishop Mark C. Tolbert, and Bishop Michael Hanna, all on the front page of the PAW Bookstore, www.pawbookstore.com. The bookstore that you are most familiar with previously, that bookstore will no longer be accessible after February 28th. So if you need order history or anything like that, you can still log into your account there and pull your order history, or you can send us an email and we will assist you with that. But this new 2021 bookstore is now everything that you need as it relates to publications at www.pawbookstore.com. You'll see there that the Christian Outlook is on the front page. You will just click on a button to place your order for the January-February Christian Outlook. You can also place your orders for, which has been very popular this week, is the 2021-2022 commentary. That is available for pre-order. That is available for pre-order. It will ship in August, but certainly we're encouraging you to go ahead and get your pre-orders in so that you can go ahead and be on that list of the first to receive it. You'll go into the PAW Bookstore, click on Sunday School, click on commentary, and that will take you to the pre-orders of the Apostolic Way and also the ebook for last year. You can order those right now. We released that information in the newsletter on Thursday or Friday, I believe. And let me tell you, those copies are being purchased like consistently, even this morning. So you definitely want to get in there and make sure that you make your purchase. All right. Anything related to the PAW Bookstore is there. The other thing that, and our presider will talk more about this, is the upcoming prayer event that we have that is going to be coming up this month. Our presider will share information about that. Everything that you need to know about any upcoming events and other resources is always going to be at www.pawinc.org, www.pawinc.org. All right, enough of that. Our amazing presider is here, Bishop Theodore L. Brooks Sr., the presider of this great organization. Bishop, how are you today?
I'm doing well. Nietzsche, how are you doing today?
I'm doing great. And I just want to commend you because I was having a conversation this past weekend, and I just want to commend you and thank you for even the conversation that we're going to have today, because you have been at the helm this last year, 2020, with the civil unrest, with an election, with a pandemic. You have been at the helm of making sure that our delegates have access to resources and information and conversations about what is affecting us, not only on the spiritual side, but also on the natural. And so that was a conversation that came up amongst some of the delegates this weekend, and they were just really commending you for this. So I just want to thank you for this opportunity, because I really want some more details about COVID-19 as well. So I appreciate that today.
All right. Well, thank you so much. By the way, Nietzsche, I didn't get a chance to talk to you, so I can announce this out now and you can get prepared for it. You're like, oh, Lord, what else has got in it? We are going to do, I want to do, and we got to talk and figure this out, put it out there. We want to do a town hall meeting with the presider. And we want to go state by state.
Okay.
And set up something where that not only our pastors can tap in and ask us questions, but also we can get to our constituents in each state. Right now, the way we do this, we only pick out so many, and you got to go online and look it up. We want to schedule a town hall meeting with 35 districts in the U.S. and even look at some of our international districts and set up town hall meetings where they can meet with the presider, ask me questions, and we have a conversation. So get ready to set that up for me.
Absolutely.
You're like, oh, Lord Jesus. Every time I talk to him, we got something else. Lord have mercy.
No problem, Bishop. I got you. No problem.
Thank God for you. You know, you're right. This is we have the prayer day coming up, not prayer day, but the prayer month coming up, March, right before we hit the Easter time. The theme for the month of March that the intercessors have put together is prayer has made the difference. Mm-hmm. And truly, prayer has made the difference for us. There's a flyer coming out. We start Monday, Wednesday, and Friday, 1 p.m. Eastern Standard Time. The number that you'll be able to call into would be 717-275-8940. And the code is 278-6970. We're going to get that out to everybody. We'll have the flyer out very shortly, and it's going to be very good. It's going to be a blessing to all of us. We have this rolling, and I'm grateful for that. But let me get and talk about today what's going to happen. As you look at my shirt, my sweater, I should say, it has on there, I'm vaccinated. COVID, crushed COVID. Yesterday, Mother and I went down and received our second vaccine. And so far, thank God. Oh, we got a little sore arm. And mine is really good. Mother said her arm's a little sore. And I'm grateful. I'm taking it easy today, kind of chilling, just being at home. But I want to, and that's what we're going to talk about, this vaccine, and talk about what it's all about. What does it mean? I want to bring on to you, the Lord blessed us at Beulah to call in a young lady. Well, didn't call her in. The Lord boarded her again to us, came out of Pastor Aida Ford's church out of New York. And she has been a blessing to us at Beulah. Meredith Benson, who is what I call the COVID coordinator for Beulah Heights Church. Meredith, welcome, and thank you so much for being with us and being here today.
Thank you so much for having me, Bishop.
All right, Meredith has been instrumental in helping us put together policies and procedures, and so that we can be really in line. Matter of fact, carried up with a group called URI, and she'll explain a little bit of that. And we become the model for COVID awareness for churches around this whole area. Why don't you explain a little bit of that too, Meredith, and just share a little bit about what you do?
So at Beulah, Bishop has charged me with ensuring that, one, we don't become a super spreader church, which is important. And then also our charge has been to be a leader of the churches here in the Connecticut order. So the first thing was to really get Beulah in right standing to ensure that we had the right protocols in place so that we could do the work in the natural, as Evangelist Nietzsche said, and in the spiritual. And so I got together with some colleagues of mine over at the Yale School of Nursing. I worked at Yale University for quite some years doing HIV research. And then I moved on from there doing first in human drug trials at Pfizer Inc. for over 10 years. And so I called in my friends and said, Beulah wants to reopen. What are some of the things that we definitely need to have in place, and what's some of the up-to-date and accurate thinking about how to reopen church as the phases of opening different businesses came about. And so we put in place a great protocol to ensure we have one-way traffic, to make sure we have contact tracing, to make sure that not only are we doing things properly with social distancing inside the congregation, inside the building in the sanctuary, but also those vendors who have business and do business with us. So we put together a protocol for all of the funeral directors in the area who will be utilizing the church to have funerals there. So we really tried to ensure that we have a safe place to worship. And so because we had done such a fantastic job of putting those protocols in place, we were tapped by an organization called You Are You, The Right to Be. And they have a program within Connecticut that is looking at churches across denominations and being outreach center for information on COVID. So currently we have over 200 churches in the state of Connecticut where we are training leads like myself in COVID education, giving up-to-date, credible, accurate information so that they can meet in kind of smaller groups to educate their church membership.
You know, you're doing a great job. Let me tell you all what she did to me one Sunday. We were just starting this practice. I had a bad habit of walking around sometime before we started service with my mask down by my chin. You know, but you come in, we have an electronic thermometer machine that tells you you're okay, you can go forward, you put your wrists up. And so I was walking around my mask up, and a couple of them said to me, Bishop, put your mask up. Bishop, put your mask up. I did it. And I came back again. You know how we do early on. So I kind of had it down a little bit. And she said, she leaned over at me and said, Bishop, if you come out here one more time without the mask, you're going to be in real trouble. Okay, put the mask up.
Well, because you know the mask is one of our best defense against exposure, and it's not only with the congregants in the church, but also he has mother and a family. So I wanted to ensure that not only was he safe in the sanctuary and keeping our members safe, but also that he wasn't bringing anything home to mother, and that was really important to me to keep her safe as well.
Yeah, and the thing of it is that this COVID testing, and you know, and I know we've had plenty of conversations about and working with Crystal at URI about the hesitancy within our community, the Black and brown community, to get vaccinated with all of the hoo-ha about it. You have a great background with Pfizer, with working for Yale, and we're going to talk about sickle cell in a little bit, which you also worked with. So talk a little bit about the myth out there about us in plain layman's term, you know, without it being, you know,
So first of all, Black and brown people have a real mistrust with the medical industry that is real. So I don't want to start off by saying that what we're feeling is not real, that it's not steeped in a history with the U.S. government doing clinical trials and using Black and brown bodies for medical experimentation. Those are very real things. They happened. You know, most of the time people, when we talk about that, they talk about the Tuskegee trial, which was very real, which really happened. But beyond what happened in the 70s with the syphilis trials, there's things that have happened up until today that raises many eyebrows about efficacy and whether or not the ethics of certain research is done in a proper way, and whether or not Black and brown people in our community are being somehow used to have this medical experimentation done without our knowledge, or with very little knowledge for us to make a correct judgment about whether or not we want to participate. So first of all, I want to say that that is very real. And I also think that because of the way the vaccine came to us, there's a lot of mistrust in our local government before the elections. So I think that that played another major role into whether or not the vaccine is seen as safe. One of the things I do want to say is that the coronavirus vaccine was actually in production for about 2 or 3 years prior to COVID-19 coming to the fore. So there's always a COVID, right? So there's always this COVID that we're always trying to treat. This particular variant of COVID was just more deadly and more invasive than what we had previously thought in the scientific world. And so now we're trying to kind of right the ship, as you say, to get us back into a place where we can be safe. So as far as the drug, the vaccine being safe, I have a couple of schools of thoughts on that. So what I will say is that the vaccine is the best tool that we have right now to stave off the virus and to keep ourselves healthy.
Right.
The vaccine has been in production. We know that right now that it's relatively potent to curbing COVID-19. We know that. We don't know long-term implications because it hasn't been in production long enough to know long-term effects. But as far as we know, the safety panel right now is showing that it is safe, that there is efficacy in stopping the variant of COVID-19 that we have today.
You know, you said something there, and I'm going to go back to that. That it wasn't. I saw it on the board there. That it was in production several years before.
Mm-hmm. Mm-hmm.
You know,
Yes.
It's interesting because most of us think that this just popped up and it just came out. COVID-19.
So I'll give you an example. So most of the times people go and get a flu vaccine. So the flu vaccine is always in production. There's always the pharmaceutical companies are working to predict the type of strain of flu that will come up. So we're always in production of making a new flu vaccine. And the same with COVID-19. There's always scientists working to predict what the mass viruses will look like and how to treat them. So this particular COVID-19 vaccine was already in production. What happened was that it had to be fast tracked. And so there was an emergency, it's called an emergency use clause. And so if something is a pandemic, what we do is we get permission from the FDA to have an early release of something that's been in development.
Now, let me go back for a moment. You have a master's working on a second master's, if I'm not mistaken, or you already have both of them?
I'm working on a second master's now.
Yeah, all you smart people out there, God bless you. You help us poor people who don't have nothing to be able to have something. Thank God for you. And I wanted to bring that up because you're just not somebody commenting on something. You know, you worked for Yale Health System, you worked for Pfizer, and you work in very strategic elements of doing strategies and working to make sure that there was the correct things about what came out, how it came out, etc. So, you know, I wanted to kind of put that out there. The other question that I would have is, and I hope you all are dropping your comments in the box so that we can be able to, ask Meredith while we got it here, because I'm going to tell you, as her pastor, as her bishop, and as the one who is coordinating her COVID stuff, coordinated COVID stuff for us at church. This is the busiest lady I know. And she gets up from early in the morning to late at night. She is working. She works with, I don't know how many different groups that she works with. And I marvel at the fact that she still takes time out to take care of the church and us. But yesterday was my scheduled shot, and you know, because you keep track of all my stuff that I do. And as I see a question, does the shot prevent you from getting COVID? Coupled with that was, if you miss a second dose within a normal time frame, which is like 3 weeks, what happens? Answer the first question: does the shot prevent you from getting COVID-19? And then, if you miss your second shot, what's the issues?
So the vaccine, it may not prevent you from getting COVID. What it will prevent you from is having the deadliest version of COVID. So you still may get COVID, and you may have, some of the symptoms like, sore throat, runny nose. You may have body aches and those kind of things, but you won't get the deadly version, which can kill you, obviously, right? So we want to prevent you from getting the type of COVID that's going to really impact your respiratory system. And so that's why it's important to not only get the COVID vaccine if you're eligible, but it's also important to get the flu vaccine. So I know some people don't believe in getting the flu vaccine, but right now, because both of those illnesses are respiratory illnesses, we want to eliminate or try to mitigate the harm induced by both COVID and the flu. So it's really important to get the COVID vaccine and also to get the flu shot to keep yourself healthy.
Yeah, now I got my flu shot. As a matter of fact, my doctor told me last year, I went to see him in December. He says, you're not leaving the office without getting your flu shot. And I'm looking at him like, If I want to leave, I'm gonna leave. You're not going anywhere. You got to get the flu shot. And I'm like, this guy, he's got the needle. Either he's gonna stick me in my head somewhere, or let me let him. And he gave me my flu shot. And then, of course, at your insistence, along with even my granddaughter Jordan, who worked and set this up for me, I have both of our shots. So if I missed the second shot, is that a real issue? If I take it a week later, or what?
So there are many vaccines where there's a booster, and so if you're getting the Pfizer vaccine that has 2 doses of medication, right? There's the Moderna, which is just a 1-shot situation. So you have to know, first of all, which version of the vaccine that you're getting. So that's the first thing. So if you're taking the flu vaccine that has the 2 doses, it's really important that you get the second vaccination when you're due, just so that it can have the best shot at keeping your immunity up to protect against COVID. If for some reason you have to get the shot later, maybe you get sick or there's something that happens and you're unable to go on a date that you were originally assigned, it's important to contact your medical provider and find out when's the next best time for you to be able to take it. It will still have efficacy, it will still be effective, but we really want to do it in that 3-week window, because that's the best chance of your immune system reacting to the ingredients in the vaccine.
Now, a lot of people have, well, not a lot, a few people have blurted out there that they took the shot and they got sick, they got this, that, the other. It's interesting because I've had both of them. But right now, I don't feel any different than what I did if I had not taken it. So is that something hyped up or what?
No, I think it's very real. What the body is doing when you get the second shot, the body is reacting to the antibodies. And so your body is saying, oh, it's like getting a little bit of a shock, saying, oh, what's happening? So that's a good sign, actually, that your immunity is heightened, right? So a lot of times people will have the second shot, and as you said, have some soreness, have some nausea, have slight cold symptoms and that kind of thing. That's okay. That's normal. We expect to see that. If you don't, that's okay too. Some people, everybody's body and physiology is a little bit different. Some folks may have underlying health situations happening, all kind of things to take into consideration. But if people do feel a little bit of sickness, 2 days after receiving their second vaccination, we expect that. And that means that the body is working.
Yeah, I got a question that says, I work with seniors. Are side effects of the current COVID-19 vaccines greater for African-American seniors?
I don't think that the side effects are greater for African-American seniors. I just think that, as I said, each individual is a little bit different. I just think it's very important that if you are working with seniors, that we do encourage them to get the vaccine. Some people say, I don't know whether it's safe. I don't know whether it's something to do, whether this is something that I should do. But when you look at a senior and the other pre-existing conditions that they have, whether it's metabolic disease like diabetes, or it's cardiovascular, like heart issues or hypertension, if you get COVID on top of that, you can be rest assured that you're going to have a hard time getting over COVID-19. So when you're looking at the risks and benefits, you want to weigh what is better for me. Is it better for me to not take the vaccine and could potentially get COVID and really have a hard time coming on the other side of it and getting healed after it? Or can I mitigate that and take the vaccine so that my other pre-existing conditions are not exacerbated by having COVID?
All right. A question up here said, is Johnson & Johnson a better alternative? 1 shot versus 2 shots, that they'll both need another shot within a year.
So I can't say that Johnson & Johnson or which one is better than the other right now. The big question is efficacy, right? So efficacy meaning is it effective against COVID? So all of the ones that the FDA has brought forward are effective against COVID, or else they wouldn't release them, because right now obviously we're in a pandemic and we need solutions. I would say that you may need to get another shot because we're we're still looking at how long after you get the shot is it effective. And that's why you still need to wear your mask and wash your hands and social distance, even if you get the shot. And I think people are feeling like, oh, if I get the vaccine, I'm home free. No, you can still get COVID. You can still be at risk if you didn't adhere to the treatment as prescribed. Your immune system may not function the way it's supposed to. We're still trying to figure out how long after you've been inoculated does that actually last. I think right now it's saying, 3 to 6 months. So you still need to wear your mask. You still need to wear a double mask. Right now, the latest out of the CDC is that we should be wearing 2 masks. So if you are really interested in protecting yourself, that's some of the latest information that's out there from our medical experts. And so you need to wash your hands. You need to wash your hands before you put your mask on. You need to stay away from touching your face, touching your eyes, and you still need to social distance. So that would be my recommendation, that we continue to practice safety procedures and protocols that have been put in place to protect ourselves against COVID-19.
Okay, there's a question up here, but leave it up there, Nietzsche, if you will. But question, not a question, but a comment, because you all have, you and my son, Pastor Harold, have always been on me about wearing the double mask. It's tough enough wearing one.
Yes.
And to put on a double mask, we're creatures of habit. Mm-hmm. And we're forced into a habit that we are unaccustomed to. And that becomes difficult for us sometimes. So, but you're saying that double mask is helpful to us.
Well, you talked about being creatures of habit. We weren't creatures who walked around wearing masks before COVID-19 happened. And now everybody, hopefully, in most cases, people are walking around wearing a mask, right? So we are able to adapt and to learn new behaviors. And that's what's important about COVID-19. There's always new information out there, and it's ever changing, because as we learn more, we do more. We're still studying the effects and how this has come about. So we're always in a posture of learning and wanting to make sure that we're putting out the most accurate and credible information. So right now, experts are saying that wearing 2 masks is indeed the best way to stay safe from COVID-19.
Right.
And we should be double masking.
Here's a question that says, is there anything I can do to prevent getting sick before taking the vaccine? Aches, flu, symptoms, etc.
I mean, as far as before you get the vaccine, again, the best thing we can do is wash our hands and be very diligent in washing our hands. Use hand sanitizer. I mean, before you even use hand sanitizer, I would just say washing hand protocol is really, really important. To wash for 20 seconds and get underneath your fingernails, all those different things. Washing between your fingers is important to that. Social distancing, all of those, the 3 W's: wash, wear your mask, and wait. Social distance, stay away 6 feet. Those are the things that you need to do. In your homes, people are, very diligent about, cleaning off their counters and hide such areas like doorknobs and cell phones and those kind of things. Try to keep those as clean as you can. Have your diligence just be up. Pay attention to your bubbles. I don't know if you have been thinking about who's in your COVID bubble. Really keep that tight. That's not a myth. That's a real thing. So in your household, stay within your household. Make sure you get tested regularly. That's another thing that happens. Folks get tested once and say, oh, I'm fine, but you don't know who you're coming in contact when you're outside. So you really have to be diligent about testing, getting tested early, and getting tested within an incubation period. So if you've come in contact with someone who has either been exposed or who's been tested positive for COVID, there's a 14-day window in which the virus itself matures and becomes contagious. So really understanding what that looks like and being tested within those windows is really important. My son actually is 22 years old and just is getting over COVID. And so when he found out he was exposed, I had to get a test. And then 4 days after that, I had to get tested again to ensure that I wasn't COVID positive. So it's really, really important to make sure that you understand the testing times and when to get tested so that you can walk around feeling confident that you are actually COVID negative.
Now, here's a question for you. If you have COVID-19 antibodies, and I wondered about this, what does that mean? A guy, salesman for a car dealership, I was talking to him a couple of weeks ago, and he said he had COVID and he has the antibodies. Yeah. I'm like, okay, we got antibodies. What does that mean? And is that person still contagious?
So if you have,
it might be tough asking you that because that's a real medical question,
right?
And we're throwing it at you. So,
well, from what I've heard experts say is that, of course, if you have COVID, you have antibodies to COVID-19, but your antibodies are heightened over a certain amount of time. So there's a time of increase and there's a time of decrease, right? So just like when you take a medication, there's something called what we call Cmax, meaning concentration max. That's the point in which the medication is most effective. So the same is similar to antibodies in your system. So right after you have COVID, your antibodies are up and raised as a defense mechanism. But then over time, they dwindle back down. So even though you may have had antibodies, you don't know how strong your antibodies are, is the point I'm trying to get across. And so people who have COVID, who have had COVID, also still need to be vaccinated. So it shouldn't be this idea that if I've had COVID-19 that I now don't need the vaccine. You still need to get the vaccine, even if you've had tested positive for COVID.
Interesting. So those with pre-existing conditions, check with their primary care doctor first before they go in.
Yeah, I think anybody who's interested in getting the vaccine should talk to their doctor to make sure that it's the right, next step for them. That's why it's important to have a really good relationship with your primary care physician, to talk with them often about everything that you're experiencing, so that they have a very clear picture of what's going on with you medically, so they can give you the best advice.
Some of these questions, I'm going to have to tell everybody that, I don't want to put Sister Meredith in a position to try to answer something medically that someone says that we said this or the other. So some of these questions, you should really go to your doctor and really have a conversation with them, and they can tell you more. I know that in our church, they set up a posture where we come in, there's 2 doors you can come in. You go down 2 aisles. The center aisle, you cannot walk down. You only come up unless you're going to go to the restroom. When you leave, they start from the rear and you're ushered out the back door. You have 2 back doors so that people don't come in and out the same way. And then we clean the church. We spray it down and clean it. Talk a little bit about the importance of doing that.
So we've established one-way traffic at Beulah, and it's to limit exposure of people crossing each other's pathways. That's a really good thing to have in place at churches. So if you are at a church that is open, it's really important to establish one-way traffic. That helps with social distancing as well. But one of the things that we did at Beulah, aside from just putting up signage about one-way traffic and talking about it, is every Sunday before Bishop gets up, Elder Harold does a COVID kind of like COVID moment. And so he talks about all of the updated information. So I give him what the updated information is from medical experts. What do we need to do as a church to keep safe? So we have contact tracing that we do. We also, when there was the different states travel advisories, we gave information about that. If someone gets sick, they know exactly who to contact so that we can keep tabs on all of that. Another thing that we did was that we also had I had conversations with our usher ministry. So I educated them on what you can and cannot do as you're seeing people, and how to communicate that information to people who are coming to church. It was important for the frontline folks at our church, who are our ushers team, to be well versed in that. And so I'm at the rear of the church working with the ushers every Sunday to ensure, that families who come in, only those families who actually live in the same household are sitting together. If you are cousins and you live someplace else and this person lives at this house, and they are not allowed to sit together. So we're really very diligent about how folks come into the church, what their interaction is in the church. Even outside of the church, we advise people that once you leave the sanctuary, when you go to your cars, you're not even allowed to congregate in our parking lot, because that's another point of exposure. So we do the education by training our frontline staff, those folks who are doing the contact tracing and taking temperatures in the vestibule. Our deacons have all been advised on the best way to move forward, as well as our usher ministry. So all of those different checkpoints are the folks who come in contact with the members as they come in. And so it's really important that you really keep up your due diligence and you have a protocol in place so that you know what to do if something should arise.
Yeah, and when you come in, you got to drop your offering in the vestibule. We don't take an offering inside the church. You do give by Givelify. Talk for a moment about what we're doing on what date is it? The 6th of March. We are going
on
to
the 3rd.
The 3rd.
On the 3rd of March, Beulah will be.
You know better than me. So the 3rd of March, we become a what?
We become a COVID-19 testing community facility, which is great because there's not enough testing sites in our town. And so if you are a church that is really interested in working with your community, I would suggest that you connect with your local community health center and try to figure out a way to do that. And so we are, this will be our first time being a testing site. We're also interested when it's a possibility to also be a vaccination site. So I think that it's really important that the churches really be involved in this work, because not only are we interested in keeping our congregation safe, we're interested in keeping the community safe that we worship in. So we will be having a COVID-19 testing site on the 3rd of March. We have approximately probably about 100 people who will come in and get tested. I will be there. Our local community health department, who is running that, they have their trained folks in it that will be taking the specimens. And so we're very excited to partner with the organizations in our city, healthcare organizations in our city.
The other thing that we're doing, and this is interesting, someone asked me, why are we doing this too tomorrow, as a matter of fact. You're going to be there also for a period of time tomorrow. One of the diseases that affects the Black community more so than any other community is a disease that we don't talk about a lot, and that is sickle cell. The sickle cell disease has I didn't realize it until I got on the board a few years ago, and I got educated about the effects of sickle cell that it has on the Black community, specifically Black and brown, but mostly the Black community, and how it can really create a lot of problems for a lot of our young people who have it, who don't even know they have it. So tomorrow we're doing a sickle cell blood drive. Talk to us.
So we're very excited about being able to do that. The first thing is that COVID, as you know, really attacks folks that have pre-existing conditions. And you can't talk about COVID-19 without talking about sickle cell. Sickle cell is a disease that has really ravaged the Black community. And sickle cell is going to be with us always, right? Unless hopefully soon we'll find a cure. But sickle cell has been with us. Hopefully COVID will be under control, but we don't want to forget about the people who suffer from sickle cell. And right now there's a shortage of blood for sickle cell patients. And so it's important that in the Black community that we have opportunities for people of color to go and be able to donate blood. And so we're going to open up this blood drive for sickle cell tomorrow at Beulah Heights Church. And it's really working with the community to take care of COVID and to take care of our community members that have sickle cell. So we really want to get those pre-existing conditions really taken care of. And we want to be a blessing to the folks who are fighting every day who live with sickle cell.
So we got a lot of things going, and again, we're very grateful for what the Lord has done and how that we got the sickle cell drive going. They want to do another blood drive sometime in May, which we have to talk about with Pastor Harold to see whether or not we can do that. Is there any other things that you want to leave with the people today that can be a blessing to them, help them to understand the importance, one, of getting tested, two, when your time comes to get the vaccine, three, to do all the protocols that they need to do?
I think you just said it there. I think, really doing your due diligence with following the 3 Ws is vital to your health. So I think people may be feeling that, oh, COVID has been around for a while. I need to relax on washing my hands, and I don't have to do social distancing as much. And, the best way to stay away from COVID-19 is to wear a mask, is to wash your hands, is to social distance. So that's the first thing. Again, if you're eligible to take the vaccine right now, I believe across the country, it's 65 years of age and older, those folks and first responders. If it's offered to you and you have opportunity to have access to the vaccine, talk with your healthcare provider, find out if it's the right move for you. The thing that's important about the vaccine is also this notion of herd immunity. And I know there's a lot of conversation about exactly what herd immunity is. But what herd immunity is that the more people who are vaccinated, the less likely the disease will be able to make more people sick. And so, for instance, this doctor gave this example, and I think it's so great. So think of the virus as a person on a wanted poster who has a mustache. And so what the vaccine is trained to do is go after that person with the mustache. But if there's people who are, if people don't have the vaccine, it sees these holes and these gaps, and it starts attacking these places that don't have the vaccine. But if all of these wanted posters are all over the place, all the virus can do is bump up against these already protected places. So what herd immunity does is it lessens the opportunity for the virus to inflict itself and to replicate itself into humans. So we really want to get as many people vaccinated to weaken the strength of the COVID-19.
So this is a loaded question, and you probably, I don't know if you can answer this. What are they projecting with this herd immunity kind of thing? What are they projecting that the volume of people in terms of population needs to be vaccinated?
Well, we have to get upwards of 65% of the population to be vaccinated, and so that's a pretty big number. And so we have to do our part to become part of that 65%, so that we can reach herd immunity, so that we can not go back to our lives as normal, because we'll never be the same, but move on in a new direction and not have the virus put our lives at risk in the way that it is right now. And that's why the work of URU and the projects at Our Humanity that we're doing with the 200 churches across the state is so important, because we really want to give people the opportunity to learn about the virus, learn how to stay safe from the virus. We've also worked with a lot of city organizations. Right now, we're working with the New Haven Fire Department. We just got permission to use their firehouses to put up COVID education banners and posters. So we're working with the schools, we're working with the funeral homes to do that, working with Howard K. Hill Funeral Parlor to do that. So we're really trying to put forward not only education, but a mass media campaign that's directed and created specifically for the Black and Brown community, because we already know that there's a lot of information that's out there. It's misleading. It doesn't look like us. It doesn't talk about what we want to talk about. We also have town halls every 2 weeks that we set up as a part of the Our Humanity project. And those town halls are really critical in us getting the correct information. And those town halls are led by Black doctors. We have it for the Black community. And then we also have town halls led by Hispanic physicians, and that's solely in Spanish, and it's giving the information. And what's great about our town halls is a lot of times you go to hear about information and the physicians are talking at you. So this particular way we set up our town halls, you can do what you're doing right now and then put in questions, ask your questions, whatever you're thinking about, you can ask those questions to our wonderful, amazing medical experts and get your questions answered right then and there. So I know Bishop has been putting the town halls that we've created out on the PAW website. We will continue to do that as a place of information. I encourage you all to join us every 2 weeks for our town halls with our Black doctors, where you can come and hear the latest information and ask all your questions. It would be great if we had a PAW town hall. We can invite some of those experts to come on and answer some of the more detailed questions that a physician should really be answering.
We're gonna have to do that. Nietzsche, come on with me, will you please? I sent you an email, Nietzsche. I sent you an email of a picture.
Okay. Let me look.
Oh, goodness. Here we go. Everybody, you got to stay with me for a few moments.
I don't know if I wait a minute. Let me see if I can get a good Wi-Fi signal here. Let me look. Bishop.
Wi-Fi, act right.
Wait, it's not acting right.
Name. In Jesus' name.
Resend it? Can you resend it?
It is a picture of a flyer that we have out.
Oh, I have it.
You got it?
Yes.
Can you post that on? Can you get that up on there?
Well, I could, but the actual image is not in the email. I did get the email, but the image is not attached.
I'm going to have Meredith send that to you. And the reason is it's a poster that says why you should get tested for COVID-19, and it has a picture of the First Lady of the Pentecostal Assemblies of the world with her hat on and her mask and her glasses and smiling.
Can you hold it up or send it to me?
Meredith, can you send that?
Yep, I'm looking for it right now so that I can send it to you so you can post it.
2/18 you send it to me.
I'm sorry, Bishop, what did you say?
The date was 2/18 that you sent it.
Okay.
She has about 50,000 emails on her. She's like, ladies and gentlemen, these are the two hardest working women I ever know. They're the only people I know that are up at 2 o'clock in the morning working on the computer on some kind of project.
Listen, there's not enough hours in the day, Bishop.
And we get our best ideas working at night, right, Meredith? We come up with great things.
Y'all are crazy. I'm sorry. Y'all are crazy, but
he did mean that. He did mean that we're crazy. He did
I mean, I'm just like, okay, like, when do y'all sleep?
Yeah, during the day.
Cat nap here. Hey, everybody that's listening, I hope that you all have enjoyed this. I hope that it's been a blessing to you. I'm very, very serious now. Get COVID tested. And when and if you get a chance, get the vaccine. Because it is important that you stay healthy and that you take good care of yourself. When the king got word that God told him to put his house in order, he said, I can't serve you from the grave. I can't give you praise from the grave. We cannot serve God and give God praise all messed up. So we need you to be healthy. We need you to do what you need to do, wear your mask, do your social distancing, and just be good. I don't know if you can get that. I don't want to keep you on.
Nope, I'm keep talking. I'm getting it up to her right now.
Okay.
Bishop,
go ahead.
No,
I was going to say the prayer is coming up.
Yes, the prayer is Monday.
Beginning. Mm-hmm.
Monday, Wednesday, and Friday, 1 o'clock Eastern Standard Time. I'm going to kick it off on Monday, followed by our former presider, Bishop Charles Ellis, and others are going to come online and take time out in this prayer because it's critical. Prayer has made the difference. Ever since we were in Cincinnati, and before that, God had it on my mind to have 1,000 people praying. Our lives have been totally changed. Mm-hmm. My life has been totally changed. And there's been an effectual working of the Holy Spirit in our lives since then. And it's been powerful. God has done it. He's kept us. He's fortified us. He's lifted us by his spirit and by his power. So for the month of March, you got to join us. And they're also, the team is working on, the program team is working on a Good Friday service that we're going to have. And we really got to do these town halls. We got to figure out how we do the town halls and let people, whether we go from state to state or just set up, periodically a town hall once or twice a week, maybe a town hall and have people just log in masses. And we might have to get a parent involved in that and do a live Zoom town hall. And we take about 30 minutes to address the general population and to just inform them. Because I need everybody to kick up their giving for the general convention coming up. We need your assistance. We need your help. We got it. We still want to do our church planting in the United States. We want to do something with missions we've never done before. We want to be able to have money for our missions department, money for, the seed churches in the United States. We want to be able to help pastors develop and grow and to do the things that we need to do. So
we're having trouble getting the photo, but I will make sure it's shared in the newsletter
share it up.
and on social media. If you are looking at the description or in the comment section, you'll see a link where you can sign up for the newsletter so you can be connected to everything that's happening at the PAW. We'll make sure that picture of the First Lady of the Pentecostal Assemblies of the World is in the newsletter and on social media later on today. Don't forget to go to the PAW bookstore to get everything. The Outlook that was for January, February has our presider on the front. You definitely want to make sure you get that and have that as a keepsake. So we have just a few more of those left. Sunday school materials have all been shipped. Outlooks have been shipped. And you can also pre-order a lot of those things at pawbookstore.com. And of course, the information about the prayer services our presider has mentioned will be rolling out to you later on this week.
Meredith, I want to thank you. I know you got to go on another call. I know you got another couple more calls to go on. Neach, thank you.
My pleasure.
Appreciate you greatly. You all have done great. Everybody out there, be blessed. Be kept, be strengthened, be fortified. Allow God to do great things in your life. Remember, get yourself in position for the promise because God has promised some good things for us. Love you all. Be safe and be careful. Talk to you later.
Bye-bye.